If you missed to watch my previous video, I'll share the link in the description box. Please click on the link and watch my previous video so that it will be easy for you to understand the details about the distributions. Okay, now let's start about the details of distribution. So here are the factors which are involved in drug distributions are blood flow, solubility and protein binding. Okay, here we can see quick to the heart means after a drug has reached to the bloodstream, its distribution in the body depend on blood flow. The drug is quickly distributed to organs with a large supply of blood. These organs include the heart, liver, kidney. Distribution to other internal organs, skin, fat, muscles is slower. Okay. Lucky lipids. Here you can see a very interesting word, lucky lipids. Why lipids is lucky? I'll explain. The ability of a drug to cross the cell membrane depend on whether the drug is a water or lipid soluble. Okay, let's see one more time. The ability of a drug to cross the cell membranes. Okay, so drug ability to cross the cell membrane is depend upon which factor? Either the drug is water soluble or lipid soluble. Lipid soluble drug can easily cross through the cell membranes and water soluble drugs can't. So that's why lucky lipid. Okay. Lipid soluble drug can also cross the blood brain barrier and enter the brain, which is very important. Huh? This question is very important. This point is very important. Okay. So what happened? Always a lipid soluble drug can also cross the blood brain barrier and enter the brain, and it is a more soluble than water soluble drugs. Okay. Now we will discuss about free to work. Why it's written like free to work? I'll explain. Let's see. Okay. Let's see here why it's written like free to work. See. As a drug travels through the body, it comes in contact with the protein. We all know when the drug travels to the body, as a drug travels through the body, it comes in a contact with the protein such as the plasma protein, albumin. The drug can remain free or bind to the protein. The portion of a drug that's bound to a protein is inactive. Okay, and cannot exert a therapeutic effect. Only the free or unbound portion remains active. So what is happening? Once the drug binds to the protein, it's become inactive. So only the free drug or the drug which is unbound to the protein, that portion remains active. Okay. So this is also very important point. Please keep this point in your mind. Okay. A drug is said to be highly protein bound if more than 80% of a drug is bound to the protein. So when we are calling the drug to be highly protein bound, when the drug 80% of the drug is bound to the protein, then it is called as a highly protein bound drug. Okay, so till here we finish the distribution finish. Now we will move to a new topic, that is the metabolism of a drug metabolism. So what we already discussed, we discussed the absorption, we discussed the distribution of a drug. Now the third step is metabolism. So first here we will discuss what is the metabolism process. What is metabolism process? Okay. Drug metabolism, or which is also called as biotransformation. Okay, drug metabolism is also called as biotransformation. It is the process by which the body changes a drug from its dosage form to a more water soluble form. So what is this process? What is the biotransformation? Biotransformation is the process by which the body changes a drug from its dosage form to a more water soluble form so that it can show a more therapeutic effect. That can then be excreted drugs can be metabolized in several ways. Most drugs are metabolized into inactive metabolites, product of metabolism, which are then excreted. Other drugs are converted into the active metabolites, which are capable of exerting their own pharmacological action. Active metabolites may undergo further metabolism or may be excreted from the body unchanged. So, the point which I said, why the drug changes, like what is happening in the biotransformation process, it is a process by which the body changes a drug from its dosage form to a more water soluble form. Okay, so what happened, why I told you that the more water soluble form, sometime like the metabolite of a drug is more active. Okay, that shows the pharmacological response. Okay, so here the point is written, most drugs are metabolized into the inactive metabolite. Yeah, the another point, some drugs metabolites are inactives. Okay, they can be excreted from the body. Okay, so that is one point. Another point, other drugs are converted to the active metabolites, okay, which are capable of exerting their own pharmacological action. So active metabolites may undergo further metabolism, and once it shows its pharmacological action, after showing the pharmacological action, that active metabolites again go for the process of metabolism, that is called as it goes for the further metabolism, or there is a chances maybe it can be excreted from the body unchanged as well. Okay, some drugs can be administered as inactive drug. Okay, some drugs can be administered as inactive drug as well. Okay, called as prodrugs. Some drugs can be administered as inactive drugs such as prodrugs. Okay, which don't become active until they are metabolized. So this is very important point. Some drugs can be administered as inactive drugs, which is called as prodrugs, which don't become active until they are metabolized. So what is happening? Some drug which is called as prodrug are the type of drug which are administered as an inactive drug. Okay, but after going for the process of metabolism, or you can say the biotransformation, that inactive drug become active, and then it shows its pharmacological response. Okay, so which don't become active until they are metabolized. So metabolism is very important for the drug which is called as prodrugs. That kind of drug are administered as inactive form, and to make it active, the process of metabolism comes into the role, and after the metabolism, that drug become active, and then it shows its pharmacological response. Now we will see where the metabolism happen. Okay, now we will see where the metabolism happens. It's very important, everyone know. Okay, liver is the main organ where the metabolism is happening. Okay, now the majority of a drug are metabolized by enzyme in the liver. However, metabolism can also occur in the plasma, kidney and membranes of the intestine. In contrast, some drugs inhibit or compete for the enzyme metabolism, which can cause the accumulation of a drug when they are given together. This accumulation increases the potential for an adverse reaction or drug toxicity. Okay, so what is happening here? The majority of drugs are metabolized by enzyme in the liver. We all know about it. However, metabolism can also occur in the plasma, kidney and membrane of intestines. So, first point, most of the metabolism where it's occur in liver. Then there is some other organ also involved in metabolism of a drug, that is a plasma, kidney, membrane of intestine. In contrast, some drug inhibit or compete for enzyme metabolism, okay, which can cause the accumulation of a drugs when they are given together, and this accumulation increases the potential for adverse reaction or toxicity, drug toxicity. Okay, now we move to the another topic that is called as Conditional consideration. What does it means? Certain disease can reduce the metabolism. Certain disease, showing the effect on metabolism, it can reduce the metabolism. These include the liver disease, okay, such as cirrhosis, as well as heart failure, which reduces the circulation of the which reduces circulation to the liver. Okay, so these are the disease which causes the reduction in a metabolism process. Why? I'll show you this diagram. Through this diagram, it can be very clear. This is our liver. What is happening? If I'm not working right, a drug does not get metabolized normally. Fine. If the organ is not fine, which is involved in metabolism, then drug does not get metabolized normally. Yeah. Okay. Now, gene machine. Genetics allows some people to metabolize drug rapidly and others to metabolize them more slowly. So yeah, this factor is also involved. Like, see, all the body types have a different metabolism process. Okay, some people even metabolism is very good, and some people metabolism is not that much good. So same applicable here as well. Genetics allows some people to metabolize drug rapidly and others to metabolize them more slowly. And stress test. Okay, stress test. Environment too can alter the drug metabolism. For example, cigarette smoke may affect the rate of metabolism of some drugs. A stressful situation or event such as prolonged illness, surgery, or injury can also change how a person metabolizes drugs. Okay, now it's very easy. There's nothing to explain in this. We can just read it. You can just read it and you can easily understand what it's showing. Like, there are so many other factors, like if somebody is smoking, that will also reduces the effect of that is also reduces the rate of metabolism. If somebody is suffering from any prolonged disease, reduces the metabolism. And there are so many basic factors also involved in drug metabolism. Now we move to the age game. Okay, so here we will see developmental changes can also affect the drug metabolism. For instance, infants have a immature liver that reduces the rate of metabolism. An elderly patient experiences a decline in liver size, blood flow, and enzyme production that also slow the metabolism. So first, infant, okay, infant liver are immature, so that why the rate of metabolism is reduced in the infant. And elderly patient, because with the age there is a decline in liver size, blood flow, and enzyme production, so it also slows the metabolism. So till here we finish our metabolism topic. Okay, metabolism topic is finished till here. Metabolism. Okay, done. Now we will, from our next topic, in our next video, we will see about excretion. Okay, excretion of a drug. Thanks for watching my video. Please show your support. Thank you very much.